Call the Public Health Committee meeting to order. First item on the agenda, public comments. No public comments. Second item, agency reports. No agency reporting. Next item, deed from Iroquois County Public Health Department.
Good morning. The first thing I gave you in your packet is your grants and contract update. Now actually, I typed that up for you on Thursday, and on Friday we were notified that Senate Bill 2047 with House Amendment 5 did pass the GA and went to the governor to be signed, and he did sign it on Thursday. So that is really good news for us. Over the last 2 months, we haven't seen a lot of grants and e-grants. We just weren't sure about the status on those grants. But I imagine now that there's funding appropriations for those that we're going to be seeing them for in the e-grants very quickly. If you look over that, the state of Illinois still owes Iroquois County Public Health Department $170,452.93, $5,876 for family case management, and $142,144.46 of that is for Healthy Families in Illinois. So out of the $170,500 that the state owes us, $148,000 of that is related to the programs that we subcontract to IMH. The balance owed for programs that we administer at Iroquois County Public Health Department is $22,431.61. The good news with that is with the passing of Senate Bill 2047, we have been notified that Healthy Families Illinois has been funded. The tobacco grant's been funded, the breast and cervical cancer grant's been funded, the Department of Aging, our senior service program have been funded, and I even received a letter from Susan Real with the East Central Illinois Area Agency on Aging, letting us notifying us that our funding would be coming soon. So it looks like almost all of our grants will be funded. The only thing I really don't know yet about is, things like the tanning program, which is only, that one's only for $400 per year. Whether we'll be paid for that or not, but we're still going out and doing that. The Vision and Hearing Preschool Grant, I have not heard anything with that one. But obviously it's very important that the preschoolers be hearing tested and vision screened. So we will be doing those services anyway. I think that that should be a priority, and that's something that we need to be doing whether we're getting state reimbursement for it or not. I think that needs to be a priority. So we'll continue to do that, and hopefully those will be funded as well. We just don't know. I was told that the Senate Bill, I have portions that I copied out of Senate Bill 2047 that I think, that definitely are obviously our grants and affect our funding, but the whole thing's over 400 pages, and try to wade through some of that language is very difficult. So we're not sure whether we'll get preschool vision and hearing funding or not. And the Illinois Public Health Executive Director Tom Hughes is wading through that to help public health departments understand what exactly that language means to the health department. So we'll know more about that. The next handout is, did you guys have questions about grants or contracts? We're getting there. Hopefully next month I'll have all the rest of the grants in the E-Grant, and then I can submit our application for them. Once the state will notify me as soon as they they'll put out a notice of funding opportunity. So as soon as those grants become available in E-Grants, then I can start, transfer them from the notice of funding opportunity page into our health department page and start doing grant applications for those. So hopefully at the next meeting this will be full and we'll know where we're at on everything. The next page is the IMH subcontracted program. If you look at the caseload, the WIC caseload, the assigned caseload is 557. The actual caseload right now is 433, so they're at 78%. Excuse me, which is above state average. I've been told that the state average right now is running between 71 and 72%. Family case management, the assigned caseload is 182, and their actual caseload is 166, so they're at 91%. And then the Healthy Families Program can take a caseload, depending on case rate, anywhere from 30 to 32, and they have an actual caseload of 27 families. The next page is the financial spreadsheet that goes along with the IMH program. I just want to point out, so that you are very clear, that these are payments to IMH versus our EDF claims, not what we've been paid. Okay? Because as I just told you that right now for the program, the state still owes us $148,020.78 for those programs that are at IMH, out of that total 170 that I told you that they owe us. So those are payments to IMH because I prepay them every month for services versus the EDF claims. The EDF claims are what we submit to the state on the 15th of every month for the services provided the previous month. So I can only claim what they turn, what they turn over to us. So that you can see that there's a difference there. So I'm hoping, because that we turn in on July 15th, we will turn in the claims for June. I'm hoping that June will make that difference up so that we don't see a loss. So we'll just have to wait and see. IMH is working diligently, and I know Ellen and all of her staff are working very hard to capture as much of that grant money as possible because we're upfronting that money to them. The next thing is the Iroquois County Public Health Department summary report. It's not really any different than any of the other summary reports I've given to you. As far as the format goes, if you kind of look it over, some things that you might want to note are that we're at a point where we're doing quite a few re-inspections. Our re-inspections went up from May 4th to 10 in June for the food sanitation program. Water samples went up a little bit. We did 16 in June. 3 of those were unsatisfactory. So they're working on, mitigation response for those. The wells, and you can see that we issued 4 permits for new wells and 4 new permits for sealed wells. And if you just go down the line, it kind of tells you where we're at with the environmental health programs, and then the second page is the community health program. Obviously, childhood immunizations are up in June. We're going to see those go up in July and in August as well. And the summer months is typically when people bring their kids in to get their school shots. That's just the way things are. Animal bites took a huge increase, you can see. That's because you typically get more animal bites in the summer. Animals are outside of the house more. People are outside more in the summer. So you see an increase in that. obviously our TB skin tests really take a big jump in the summer as well. Most of that's employment related and school related. So we do a lot more in the summertime with those. Our jail program inmates that we assessed is back up. We had a few low months, but that was when the population at the jail was lower. I did speak to Sheriff Hagan about that. He said that that they had a few months where the jail numbers were low. But you can tell when they go back up because then our assessments go back up. Obviously, we didn't do any school health services, or very many in June. Milford schools did have school days in June, but we didn't track those days because there weren't very many. And then obviously, the vision and hearing screening dropped down greatly in June because school's not in session. And then our numbers with senior services, as you can see, fluctuate, from month to month, depending on how many cases are reported to us through adult protective service programs. Do you guys have any questions about service numbers?
So you did have a Lyme case there. Was that something that was positive?
To be honest with you, I'll have to ask Rhonda about that. She takes care of all that. The director of nursing does most of those investigations. She only asked me, to become involved because I did it for many, many years. I was the communicable disease coordinator. She only asked me for help when something she can't handle, but I'll have to ask her. I'm not sure whether that was or not.
Yeah, if somebody needs some help or something, let me know.
Yeah, I definitely will. Just a little bit of additional info, not much. On June 14th, we had our strategic national stockpile drop. The Sheriff's Office sent Deputy Brandon Legan out to help us with that. We're required, once that drop is made, to be escorted by law enforcement until it's locked up. This SNS drop did not involve medication. It was PPE, protective personal equipment only, personal protective equipment only, gowns, gloves, masks. But it was a great way to exercise the IMAT system, our request system, in case, what we would need in case of an emergency, in case of a biological threat or, God forbid, a bioterrorism event. How we would go about requesting assets. I think it went very smoothly. The only thing that we really had a problem with was when the drop showed up, there was no inventory sheet with it. So we didn't know if what we received was what they intended to send us, So we had to make our own inventory sheet. So we did that. Counted everything, double-checked everything, wrote every gown, glove, mask, shield, everything down, how many we received, what the lot numbers on the boxes were when they were to expire, and made our own inventory sheet and sent it into the regional Public Health Emergency Coordinator, Lynn Reagan, at the regional IDPH office in Champaign. She sent that on to the state. They confirmed that what we received was correct, and we were good to go. But it would have been nice, at least the other few drops that I had been involved in always came with an inventory sheet. So I'm not sure how that happened, but it went well. On June 15th, we had our full-scale exercise out at the county fairgrounds. You probably saw pictures in the paper.
Yeah, what?
A full-scale exercise.
Oh.
We practiced. The entire health department staff went out to the fairgrounds and we set up just like we would if there were an event where we had to provide mass prophylaxis, whether it be an antibiotic, an antiviral, an antidote, a vaccine, whatever it would be. We set up just like we would. We instead of giving out pill bottles with pills in them, we gave out pill bottles with lifesavers in them. But we practiced our throughput. In other words, how fast could we distribute those necessary medications to the general public. And we started off pretty slow, and by the time we ended, we were down to 1 minute and 1 second per person. So that's pretty good. I don't know how we were going to get any faster than that. We appreciated. We had a lot of people that came out and volunteered. Michael Johnson volunteered for the day with the health department. The sheriff's office sent someone. We had volunteers from the Milford Fire Department. Wendy Davis from the Friends of Public volunteered to help us. We had Board of Health members that came. Lisa Brightmeyer came to help volunteer. So it was very nice. We learned a lot. That's the whole point of that, is to see how well you'll do. So afterwards, we had an after-action report and improvement plan meeting, which we call a hot wash, and went over what worked well and what didn't work well, so that we could make improvements on our plan in the future. So it was a good day and a good learning.
It was a big thing.
It was, yeah. Learning what we needed to do to get people through faster. What things we could combine, what things we could eliminate, what things were necessary that we had to add back in. You know, it was a good learning experience for everyone. But I can tell you that if we have any kind of an event like that in Iroquois County, our staff is about as well trained as anyone in the state. We have attended all required trainings. Eric Stacy, our Public Health Emergency Preparedness Coordinator, has attended every single training that the state requires, and most of them that they recommended. So we're doing our best to make sure that we can serve our population well. Do you have any questions about that full-scale exercise? We're recertifying our staff with CPR. We've gone through our N95 mask fit testing for all of our employees in June. And we're looking forward to having a booth out at the fair again this year. It was the recommendation of the Board of Health that we had Radon money, and the Radon is the only grant, it's a federal, Radon is a federal grant that allows us to buy anything to advertise, and they encourage advertisement with the Radon grant. They want you to distribute things to the public to get them to come to your booth to get to pick up the free Radon test, to have their home tested for Radon. So what we decided with the approval of the Board of Health was to have water bottles made that have our health department logo on them, and on the back in big letters it says, "Have you had your home tested for Radon? Please see us for a free kit," and it gives our number. But we'll also be giving free kits out at the fair, so people can have their homes tested for Radon. Radon, as we know, is the number one lung cancer causing thing for people who don't smoke.
Is Zika?
Zika?
Zika? Is it a concern?
Not right now. There aren't any locally transmitted cases in the state of Illinois.
Nothing in Illinois?
There are cases in Illinois. The last time I checked, there were 17 cases in Illinois, but they were all from people who had traveled to other countries and brought it back.
Well, where at in Illinois?
All across the state. Yeah, those are travelers. But they did not, there have not been any locally transmitted cases at all. So no one has been infected from a mosquito found in Illinois at this point in time. How long it will remain that way, your guess is as good as mine. I said this at the last meeting. And when West Nile virus came out, they told us that it would take a decade to go from coast to coast, and it took 14 months. That was West Nile virus. Will Zika virus be like that? We don't know. Zika virus is usually not found, it's found in the Aedes mosquitoes, whereas West Nile is usually found in the Culex mosquitoes. So those mosquitoes are different types of mosquitoes. The Aedes mosquito that carries the Zika virus doesn't like cold weather, so it doesn't tend to travel up as north in the United States as the Culex mosquito, which carries West Nile. So we don't know.
I know they talked about different, I want to say breeds of tomato. Mosquitoes.
Mm-hmm.
There's big ones, there's little ones, there's tiny ones, there's all different.
Oh yeah, there are different kinds of mosquitoes.
Different kinds.
Like there are all kinds of dogs, you know. Yeah, definitely. Our big thing will be for this year, which we've already started our sampling. You can see that in the progress report. We've got 4 sample sites where we're collecting mosquitoes in 4 places around the county, and those are checked every morning. And then Terry goes through and identifies those mosquitoes, and then if those find mosquitoes that carry West Nile virus, then he literally takes the tweezers and takes them out, and then they test them to see if there's the presence of West Nile
Was
virus.
what you had caused by mosquitoes? Don't know.
So we'll see, but we have had 2 big tire site areas in Iroquois County that Terry has been working with, who've been very cooperative. One was an IDOT site, and the other site is an Ashland site, and they have been very cooperative. IDOT has already cleaned their tire site up, and the other site is privately owned property outside of Ashland, and they have been very cooperative and have told us that will be cleaned up by August 1st. So they're working on it. So we are very fortunate that Iroquois County residents and businesses are willing to make sure that they don't have a situation where there's a lot of water-containing receptacles like tires and containers that people aren't willing to clean up. Most people have been very, very willing to clean up anything that we've asked of them, and we've explained to them the importance of keeping the mosquito population as low as we can in Iroquois County. So lots of education, wherever we speak or present, we make sure that we let people know what control methods they can use to reduce their risk of being exposed to West Nile virus. You know, you want insect repellents, you want to wear long sleeves if possible, you want to make sure that you have screens on your windows to keep mosquitoes out of your house.
Well, I don't know why, but I live in a lake community, Lake Iroquois, and then there's Bales Lake, but we're not necessarily bothered by mosquitoes down there. I don't know if the water's fresh enough, or I don't know what the biological reason would be, but we're pretty mosquito free. Well, not totally, but pretty much.
Yeah. Different areas, depending on it depends on the rain, the rain level. It depends on what kind of mosquito abatement you're doing. If you have someone who's applying larvicide, that certainly makes a difference. The health department will be distributing larvicide to those who have an operator's license and an EPA permit. But if you don't have an EPA permit or an operator's license, an application license, we are not going to be giving you larvicide. Our rules are very strict with that, because we've had a lot of township officials that have called us and asked if they could have larvicide, and we certainly are willing to provide that for them with using our West Nile virus, our vector control money. But they have to meet the EPA regulations, and they also have to have an applicator's license.
I remember when I was a little kid living here in Watsika, mosquitoes were terrible. They were horrible. And that's my story.
Do you guys have any other questions? Thank you.
Thank you. Next on the agenda, any old business to come before the committee? Any new business? Hearing none. Excuse me, I would entertain a motion to adjourn.
Make a motion?
So moved. Second by Jed. All in favor to adjourn, say aye.
Aye.
Opposed, same sign. Meeting adjourned.